Hey, this is Bridget.
Hey everyone, this is Matthew and Geneva here. We're gonna get started in just a second. In terms of attendance, I see, I'll call out people I see here. Josh, Julianne, Tasha, Bridget's there, also Kevin, both from HO. Jamie, which Jamie is this?
Good question. Jamie Zaplatosh.
I do, Zaplatosh. Great, okay. And then I see Jill. Anyone else I'm missing that I haven't called out?
Sadia.
Oh, hey, Sadia. Good. How are you?
Josh is here. Sorry, I just called in.
Hey, Josh.
Hey.
If you have access to a computer, that'd be great. We're going to have a presentation. We can probably cover without, but if you can log into that Zoom link and you haven't already, that will be helpful. This will be a more visual discussion. We'll give it maybe one more minute. I think most people we expect are here.
Yeah, I think we're waiting on Jamie Hand.
There's Jamie Hand right now. I see her. Jamie, are you on the call yet? They probably still dialing in. I think we're almost here. Jamie Hand, I think, are you on the call just now? You have to be dialed in.
I am. I'm here. Thanks.
Hey, Jamie. Good. Okay, so we have both of Jamies. I think we're maybe waiting on one more, but let's go ahead and get started. It is Friday and holiday season, so we want to make sure cognizant of your time. We want to just kind of reconnect a little bit. Maybe Geneva want to find some ways to do that.
All right, I'll do my best. Well, hello everyone. I'm really glad we're all back on the phone together. It's been a while, but on the last call, we did a little icebreaker, and it was right before Thanksgiving. So in that same spirit of thanks, I hoped we could all go around and share something we're thankful for in our professional lives, sort of as like an update or something that you're really excited about or excited to have already happened. Matthew, you can start with an example.
Yeah, we don't do it all around, but maybe a couple of examples. Just I'm curious what this group's working on and what's interesting to them right now. One thing I'm thankful for, and we'll introduce her in a minute, is we have a new member of the TPL team, Sadia, who's joined us as our health director. So we'll go around and do updates, but I'm thankful to have her on the team. I know the larger organization is very thankful as well. So that's my things, but I'm curious if there's maybe one or two others would be interested in sharing some things that are going well or of interest in their professional lives.
This is Jamie. I'll be a guinea pig here. Jamie from Our Place. Just to say that we have a it's been sort of a crazy, as many of you may know, Our Place is preparing to sunset at the end of next year. So it's been just a lot of transition and complicated conversations and a lot going on in that regard. And we have a retreat coming up next week instead of a holiday party. And one of the things we as a team agreed on is that we just want to hang out together and not talk about work. And that actually I feel really fortunate to have a team that also likes each other and wants to spend time together outside of all of the tough stuff that we've been working on. So I feel really lucky.
That's great, a great example. And if you want to invite all of us, we also love your team. So that would probably go against retreat, but
it might turn into work then, though. That's the challenge.
Oh, yeah. We'll have fun with that.
Kidding.
Thanks for sharing. Anybody else?
This is Tasha Golden. Can you guys hear me okay?
Yeah, absolutely.
I'm in a loud space, so I wasn't sure, but I was super fortunate recently to be in the Netherlands and got to connect with an artist named Claudie Youngstra. And if you aren't familiar with her, like her work is just so beautiful. She works with wool that is like native to the Netherlands and dyes it using like plants that are in her own garden. And just talking with her and how they're using their work to help reconnect people who have had trauma histories with the earth and with touch and with textiles. I was able to visit her studio, and it was just, I expected it to be inspiring, but it was far more inspiring than I could have imagined or been prepared for. So I've been very thankful for that.
Awesome, thanks, Tasha. Maybe we can share a link or two after the call, so
sure.
that we can see that. That'd be great. Anybody else before we dive in?
This is Sadia. I'm going to jump in and say I'm super excited and super fortunate to be joining the TPL team and learning from everyone here as well. So looking forward to digging in.
Well, that's a good segue, Sadia. I just want to, as I said, Sadia joined this week. I think Monday was her first day. We're really grateful for her, obviously her expertise, but also her collegiality, and we're excited to have her on board. Sadia, do you want to say any, we've been putting you on the spot a lot recently, but any quick words about your background or what you're excited about in terms of your role here at TPL?
Sure. So my background is sort of through and through public health, and I most recently was in the healthcare space, and just really was sort of thinking about the way that we think about health, and realized that, you know, it's the sick care model is not going to sustain us long term, and identified this just this sort of amazing opportunity to bring together that space and place, and especially green spaces inform how we're doing as a society, as a community, as individuals, and in our neighborhoods. And having grown up here in Baltimore, have such a distinct visual, it's just so stark when you drive through within a few blocks of how green spaces change just based on that experience of poverty. And so I'm excited to work on this, and thrilled to be part of the team of folks who are so committed. I think that was really, really just striking in my interview process. So yeah, is anything that I should touch upon, Matthew?
No, that's great.
Okay.
That's great. Yeah, I'm looking forward to it. You know, we're lucky to have this kind of awesome steering committee. If it's I think one of the biggest successes of this project so far is this exceptional group of people that we're really. So I'm looking forward for you to get to know them, and vice versa. So that's really exciting. So let's dive in. So in terms of this meeting, we have some things to cover. We sit around. I think we have, just as a little bit of preface, we've changed it up a little bit. We actually are having 2 steering committee calls, just to kind of get the group size down a little bit and to encourage conversation. So we set that around. We had 1 call before Thanksgiving, and this is the second of those calls. So the first one was really interesting. We had a lot of good feedback. So we're going to be reviewing that document. I'm going to present a little bit of a presentation that frames that same document. Then we're going to turn it over to Kevin for a little bit, who's been doing some research as a kind of a fellow at NACCHO. He can talk more about his role there, doing some literature review and scanning that will continue to grow and be incorporated in this project, and we're grateful for his work. And then we're going to talk about the kind of the case study process, and that's a little bit more tactical about where we've landed on that and what are the next steps. So that first one, though, I think is the most important, because in some ways it's the kind of foundational to the project and where it sees itself in the ecosystem. So this presentation, I'm going to, just as another caveat, this presentation is kind of geared a little bit more external. I'm going to share it and go through it a little bit quicker, so just kind of be cognizant of that. But it doesn't, as I said, try to recapitulate what that document that we sent around did. And that document was really in response to some conversation we had earlier about wanting to synthesize how all of these constituent parts work together. How do these things, whether it's arts and culture, whether it's public space, whether it's health, how do those things, whether it's equity, how do they relate to each other? So this is our kind of attempt to do that. One small thing, but the big thing, is to reframe this goal statement and put health equity up front. So the goal of this project is really to support the achievement of health equity for all communities in America. We want to lead with that, and not necessarily, you know, parks or open space or arts and culture. We talk about health equity here. I'm not going to go over these definitions and such. We talk here about health equity being such that everyone has a fair and just opportunity to be as healthy as possible. And in particular, it requires removing obstacles. And we set that up purposefully to think about what are the obstacles that we could help remove to help achieve that health equity. This is, again, kind of a recapitulation. You've probably seen this before in our earlier presentations, but framing this, in order to remove those obstacles, we have to think about place-based factors. So all of these quotes have been circulated quite a bit, that zip code is a predictor, that life expectancy can vary by block. All this to go and say that those things that are defined by place define our health and health equity ultimately. So again, building health equity requires us to think about place in very purposeful ways. But then there's an important question whether you're a health expert or just a resident advocate. Why is this the case? So in order to talk about this, we use the framing that we've shared before around that the Prevention Institute has developed around health inequity. And these are the things that as a layperson who's not a health expert, I first started thinking about public health as these kinds of things, these medical conditions. But ultimately, these are kind of the far downstream effects of health inequity. So higher rates of heart disease or other kinds of issues we see here. And then if you keep going kind of upstream, further upstream, these are built, and this is all kind of one-on-one, so I apologize if this is like, but for us, it's important to work through. But exposures and behaviors are building to those medical conditions that negative perspectives are of tobacco and smoking, alcohol consumption, and all down the line. These are those things that lead to medical conditions. But there's actually even more upstream impacts to talk about here, and that's those broader structural drivers. So at the highest level, it's that inequitable distribution of power, money, opportunity, and resources, and then people who are disempowered from making decisions about their communities and their own lives. And that the way that works, actually, the way that the structural drivers are instantiated in community are through community determinants. And this is obviously where we have done a lot of work and talked about work. And Sadia, for example, I know you've done this at a lot of your previous roles, and this is something that we're conversant in about these kinds of determinants. We use this framework here that, again, is prevention, opportunity cluster, and then quality healthcare. So in looking at this, we're thinking, these are the things that are ultimately going to build towards more positive medical conditions. And we know that places with strong people, strong physical environments, and strong economic opportunity thrive and build lasting health equity, not just kind of static impacts, but health equity that moves through time and over generations. And looking at this list, and now we're getting down to why we're talking about this work here. There's two determinants that are pretty prominent. And if you look at the place cluster, there's only 7 of these items here, and 2 of them are issues which we're talking about: parks and open space and arts and cultural expression. So what do these mean? Why is it important to this work? What does it actually mean specifically? That's looking at it from a broad ecosystem. Where are there more direct impacts? So the question here is, we know, and this is based a lot on research that, for example, Jill's done and others have done, that we know there are direct impacts on both of these around collective trauma, social exclusion and isolation, mental health, chronic disease. On the parks and open space side, very similar direct impacts based on exposures to these 2 things. So mental health, active recreation, social exclusion and isolation, and chronic disease. Obviously, this is a agglomeration of a lot of research and a lot of assessments, and it's very generalized and away from the application of these interventions. But at a general level, these are the kind of direct health impacts we can ascertain from them. But why are these connected, and what's the kind of imperative between these 2? And that's the kind of thing we were wanting to kind of get more at in terms of this work. So we look at these determinants on kind of face value, and we argue that the presence of strong community determinants like arts and like parks is not sufficient to build health equity. Communities need empowered people, and they need equitably distributed resources and power. So we're proposing, and this is based on research, obviously, that not just the presence of these, but using these to actually build people that are empowered and are able to inform the equitable distribution of resources and that power. So they're almost conduits for something more broad. So this is kind of a way to look at these in two frames, that the Prevention Institute has place determinants and have people determinants. You know, we're arguing that actually they should be aligned together in very purposeful ways, particularly when it comes to application and kind of policy development. That community determinants is a really important frame to think through. So health equity requires place determinants be in equal measure with the people power that builds lasting structural change. So I want to pause this and I'll walk through it a little bit. This is kind of where I want to maybe pause for a bit and have a conversation about what this looks like. And so arts and cultural expression in parks and open space, we've talked about these evidence-based direct impacts based on a lot of work over quite some time to understand these. But we're also want to kind of argue for the capacities and benefit that build towards that people power. And we here are arguing that arts and cultural expression are important for that work. That means that arts and cultural expression can shift perspectives and build meaning. They can improve health communication and advance community-generated health practices, organize and mobilize, and that parks and space, open space, are a foundation for community advocacy and decision-making. They promote healthy activities and exposures, and they're a public amenity for shared experiences. Ultimately, both of those things, the conduit, the kind of the means, and then the space, track towards a builder of collective efficacy, empowered communities, and equitable distribution of resources, which is therefore building health equity and therefore building that long-term structural change. So that's a lot and maybe kind of a little bit up at the 30,000-foot level, but I wanted to ask this group, based on some previous conversations, whether that framing was a helpful step forward in relating these kinds of disparate pieces, or what work we still need to do, or we want to have some gaps. And I want to make sure we're going to get to the kind of how, like, okay, if this is true, then what are we doing through a toolkit to advance this work? So we'll get there, but this is mostly a conversation about, have we the right language? Have we used the wrong language? Is there more research to do? Do we need more clarity? So we'd love your feedback on this so far. If anyone's so brave to take that first step.
This is Jamie Zaplatosh. I have to say, I think you guys did a really, really great job on integrating all of the feedback thus far and really putting together a comprehensive, inclusive, and really to the point document. So I like what you've done so far and appreciate it.
Thank you so much.
Yeah, great, yeah. Who else? We could end on very good, and then before that would be really easy.
No, I want some negative feedback.
Hey, this is Josh. I think one thing that might be helpful to spell out a little bit is just, you know, we do this a lot when we're talking about equity and sort of defining equity versus equality, particularly like in parks and open space, just because, you know, equity refers to understanding the specific needs of communities that you're serving and ensuring that the resources are necessary are existing there. So that might be something that would be helpful to spell out a little bit. You know, it's not just the presence of parks, it's the types of parks that exist in communities. Are they reflective of who's there? And I think that's where we get into the arts and cultural expression a little bit, that you're understanding who you're serving. But I think that's one thing that maybe could be spelled out a little bit, or just, you know, right up front, you know, we have some diagrams versus equality versus equity that we like to share where, that we can share with you, but I think you probably have seen those before. But that might be something that might be helpful to spell out a little bit clearly up front.
Yeah, that's perfect, Josh. I know this, which meaning. I've seen this before, I think that you've shared, so yeah, really helpful.
This is Jamie Hand. I have a question, and I don't know if you would mind going back to the slide where you had the different clusters, and that you had arts
Jamie,
and culture.
You cut out there at the very beginning. Could you restart that?
Sure. Can you hear me better now?
Yes.
Picked up the phone. So would you mind going back to the slide that had the clusters, like where you actually had circle arts? It's basically a question of sort of sharing out attention. And when I read the document that you shared in events, sorry, even before that, one slide before that. Keep going. It was just sort of like building up to this idea that arts and culture and parks were part of the same cluster of social determinants. There you go, that one. Yep. Yep. So the question, and I think both in the theory change and as you're building up to talking about this, the tension that I'm feeling is sometimes you're talking about arts and cultural expression as a physical asset or as infrastructure that needs to be activated, and then at other times you're talking about it as the people power thing, as the activation itself. And sort of in this community determinants list, under the people cluster, norms and culture and sort of socio-cultural environment, that's also culture and arts and culture. So there's a little bit of a slipperiness, and I'm not just throwing stones. This is a tension that we feel all the time in this work. And so I just sort of wanted to lift that up and say that that is still like where it actually falls. Like, since you're basing this theory of change on, okay, great, these determinants are there, the infrastructure is there, but it needs to also be activated. Just being really clear about where you're talking about arts and culture as an input or as an output, or not an input-output, but as an activator, and where it falls within your logic model is something that was a little unclear to me.
Okay. Can I restate something and see if this is how you feel about this? I think the way we've been thinking about it is as both, that it is both a kind of in that physical cluster, but that, and this is kind of to Josh's point a little bit too, but that when it's successfully leveraged towards health equity outcomes, that it starts to actually blend that people cluster and become part of that building of normative culture, that building of social networks and trust. Maybe I can, from a kind of parks perspective, which we know obviously a little bit better, we think of parks, the mere presence of them, like having access to a park or open space is a good first step, but then we look to build towards that kind of higher order of a park that has a strong friends group, that is stewarded, that is socially relevant to that community. It's almost like a hierarchy of excellence in some ways. So I think that's how we've been thinking about it, is actually not just the mere presence of, but actually purposefully and thoughtfully considered in the context of that community. But I hear your point. I think we still need to do a better job of articulating that kind of.
Or maybe just saying both. I think just even in the presentation today, hearing it and seeing it circled as a physical one, but not as the sociocultural one, I think threw me off a little bit. So being able to say we believe it both exists and needs to be activated in the case of both parks and arts and culture.
Okay, perfect. Yeah, that's really helpful. Thanks.
Anyone else?
This is Jill. Just a couple of thoughts. And first, to say this is really, really exciting and exceptional work. You all have just done a great job, and I'm really grateful for the work that you've done. I'm excited about being able to utilize this document. Just a couple, the things that come up in my head, which may not be meaningful, but I'll share just in case. The term arts and cultural expression, I live in a world of artists and creative arts therapists. And so in the world in which we meet, language, of course, is really important. And the notion of expression, which is, of course, something that we all do and is a general idea, can also be associated with the creative arts therapies. So that sort of comes up in my mind, not as a problem necessarily, but just as something to think about, the associations that are drawn, from language like that. And I also go with that term to the notion of arts and cultural expression as an action, as a particular way of engaging in arts and culture. That may not, like I hear Jamie using the language arts and culture, which to me is a very, very broad, inclusive thing. Arts and cultural expression, to me, narrows it down a bit to those who are doing the expressing, those who are writing, singing, making, those sorts of things. So just a tiny, tiny little thing. And then I also, I love the relationships that you're bringing together here and that you're forming through this beautiful logic model. And the when I see the therefores in the final statement, like my sort of researcher brain ticks on, and I want to understand better what therefore means in terms of, you know, association, relationship, causation, those sorts of things.
That's a great, yeah. Both of those are really good points, and I appreciate the language, particularly on arts and culture. And this goes both to your point and Jamie's point about being very clear about that. And it's obviously, Jamie, as you said, it's a field that is sometimes always imprecise and productively so, but we need to be very cognizant of that.
Yeah, and we can, you know, debate preferences in language all day long. I'm not at all saying it's wrong, just sort of sharing what comes up for me.
Yeah, it's not so much wrong as to be purposeful about it, I think, you know, yeah. to understand the various kinds of contexts in which that language meets all kinds of people. Yeah. And then that last bit about the therefore, it's a really good point. That's very good catch, and something that actually I've been thinking about, you know, what is the kind of research in that therefore that we still need to do, or could we connect? So it's a very sharp-eyed, Jill.
And just to get to underscore,
Matthew, just to underscore, this is Jamie again, Jill's point about arts and cultural expression. The other, you know, words are participation, engagement, involvement. Mm-hmm. You know, just to the reason why we shorthand it with that big term, which other people have problems with, is because there's so many other ways, as Jill said, of participating in the arts.
Yep. Okay. Great.
Mm-hmm. This is Julianne. I'm wondering, how are you defining the conduit? That word is intriguing. I'm just what's your definition of that?
That's a good point. I think.
Oh, go ahead.
Yeah, I think it is less that physical and more of the call it a kind of connective activity that exists. To use maybe a more concrete example, to talk about it in more concrete terms, in our work, as we are, you know, this is just STPL's work, we obviously think quite a lot about building parks, park access, but when we are thinking about connecting communities to parks, about building advocacy for both parks and broader issues, oftentimes we are leaning into the arts as the way to do so. And so that's obviously not necessarily it is kind of that tool towards that change. And so in some ways we think of maybe as the conduit to that people power, building up that people power. And I think this very much goes to the comments earlier about you know, where things exist in that as a physical asset, as, you know, having the presence of arts and culture in a healthcare setting obviously has impacts. What does it mean in a kind of a community development setting that might be different? So being clear about that. But I think, to your point too, I think we need to probably spell out this kind of ambiguous term, the conduit, a little bit more to make that clear. And I actually think that this whole conversation and some of the comments earlier will help us do that more precisely.
Great. I was hoping that's what the meaning was, but when I first read it, I probably would have interpreted it as like a physical structure or the actual art installment, or so. Yeah. If it was published, I would worry about the interpretation, but
okay, I think that's a good perspective.
Hey, this is Tasha, and I just wanted to echo what folks have said about just a deep appreciation for all of this work and this document, and how it has immediate uses. I'm also excited to see what you're working toward with the toolkit. So thank you guys so much. And I think just building on the language thing, I would not say that it was bad necessarily, but to alert you to a lot of contention or controversy around the term empowerment or disempowered. So especially since that that term disempowered people comes up in significant places in your document, just to alert you that that might, it has connotations around how so for me as a rhetorician and things like that, like there's a way in which, like, it is true, people have had their power taken from them, which is another, way to say disempowered. But then at the same time, there are ways that people always have powers and assets that are just not being recognized or used. And so describing them as disempowered sort of doesn't acknowledge those. So it might be good to find a different way to acknowledge that kind of balance. But yeah, just wanted to put that out there as something to consider.
Yeah, that's something we're conscious of that, and this is kind of, we're borrowing a little language here. And we've been thinking about that term. We've also been thinking about the term generate, which is in the slide here. You see shift perspectives and generate meaning. We've been thinking about, to your same point, maybe not generate meaning, but lift up, existing meaning, or I'm not sure what the right word is, but there's a couple pieces of language that we are thinking about. So we'd love to keep sharing some ideas with you, and maybe that would be a good next step, is to be precise about that, or at least articulate a rationale for. It's something I think about a lot. I'm personally, I'm even moving away from like community engagement as a specific word. There's all kinds of I think traps in that, but I appreciate your eye towards that. So.
Yeah.
Yeah, this is Josh. At DOH, we're constantly, reviewing the language that we use. And so I think we're coming out with some guidance soon as an agency that we can share with you. Empowerment came up, and that discussion marginalized all of these sort of terms that can be somewhat problematic depending on who's reading this. So hopefully that comes out soon and we can share it with you guys, and hopefully, integrate it into this document.
That'd be great.
Love it.
Josh, that's something we could share with the whole steering committee, just for, just because.
Yeah, absolutely. It should be a document that we can share with everybody.
Okay, great. Yeah. And Tasha, you were going to say something as well?
Oh, I was just going to say, thank you, Josh. That would be amazing if you could share that with all of us. And I was going to say, there's also a really positive spin, of course, with the language change, in that so much of your document and the language here is about recognizing that. Jill and I have found this with the advisory briefs and things like that we've been writing for creating healthy communities as well, but helping people recognize that there are existing assets in every community. And so if you choose not to describe the population as disempowered, then you can bring a little bit more attention to the fact that they have powers and resources and assets that just have not been accessed or valued. And that can be especially valuable for communities that have felt that they are under-resourced, or even local health officials that feel like they don't have the funding or the resources to do as much as they would like to do. This is a way to kind of direct their attention to, like, well, actually, there's a lot of innate resources in your communities that just haven't been valued in ways that they could be.
Yeah, great. I like that dual perspective too, both from a health professional and as a community member. That's a really important frame.
Just a quick, also positive note. We've been doing some user research with various health professionals, several of which are on the committee, and something that's been really encouraging to Matthew and me is that you guys are super with it when it comes to language and appreciating asset-based language, and that's just something that we're going to continue developing, and are definitely open to further feedback around that. So more soon.
And I'll just add that as part of our update to the active design guidelines, we're now currently reviewing our document from 2010 to sort of look at language that might be, all the things that we're talking about, looking for sort of racial undertones or ways that people might be disenfranchised by the language that's in that document, and really looking for people first type language. So that review is ongoing right now, and any findings from that, I'll certainly share that we can sort of include in this upcoming document.
Awesome.
Great, yeah. Any, before we move on to the next bit, any further comments? If you do, or if you continue to think about some specific things, or as a resource, or this particular language that exists. We want to get this right. I think this is important. We feel kind of this is not a decision point, but something we want to build this as a strong foundation, such that when we continue to build the toolkit and think about our next steps in terms of where do we have some research gaps and needs that we can but let's go ahead and move forward here. We want to talk a little bit about what actually is going to come out of this. And so we've updated our activities and outcomes. I want to talk more specifically about what the activities will look like in terms of actually what are we going to produce from this. And so these activities will probably exist in what we're calling kind of our report or document, and we'll talk about some of the kind of various kinds of toolkits or toolkit pieces, what we're going to produce. But in this kind of core resource, these three things are maybe most important. The first is presenting research evidence and case studies about the efficacy of arts and cultural expression as conduits for health equity, and parks and green space as spaces of health equity. This really is just saying that this is a synthesized introductory piece of work that explains some of these concepts, that points to other resources that also exist, that grounds us in this particular inquiry. And then second, we want to provide kind of clear, replicable interventions. So in the first instance, we have case studies around that, and actually we think these case studies are going to be really important. This kind of storytelling is something that we're hearing from local health officials, that those stories are super, super important. You can't have enough of them. So those case studies will be very specific, obviously, and they'll have their own context and conditions and opportunities. But we also then want to provide generalized, replicable interventions that learn from those lessons, learn from the evidence, and propose a kind of generic frame that can be utilized by local health departments, and be done so through a range of types of work, but also scales of resources that might be available. We can obviously point to case studies or point to other examples in those, but we want to make these as replicable as possible. And then lastly, establish some broad policy guidelines. So whether that's in terms of partnership development or community engagement strategies or funding models, these would be broader kind of more enterprise level recommendations. So these things we think about in terms of activities. I won't talk to you about the outcomes, but if there's some comments on that, we can get to that. And then the impact we talk about, leading with that health equity, is really important. And then that long-term ability to advocate for and champion equitable practices and decisions by and for communities. So then the last thing, so how will that be described? Those activities we want to do, what will actually be the physical results of that? We have 4 pieces here. We are confident the first 2 will be done. The third one is in discussion. The fourth one is very likely, but there's some funding dependencies there. So to walk through this, that resource guidebook will include those kind of activities described previously, 5 to 10 case studies kind of included as part of that. We'll be doing interviews in the field. We'll be doing outreach, research around media, research around evidence base that's been produced from there. So we'll produce 3 to 4 page kind of case studies. Hopefully that body can grow as we develop this project. So that will be kind of the core of the toolkit. But the next 2 are kind of interesting. We'd love your feedback on this. The third one is a certification module that we are exploring with Arizona State. They are developing a kind of micro certification process for all sorts of professional education, which can be done fairly lightly over the course of a few weeks. That can develop certifications around specific practices. This could be a small curriculum that could be, co-taught by a community of practice. It could involve some of you, perhaps. Professionals can take the module, learn about this work, and receive certification for that. We really like this because of the network that NACCHO has and the ability for this to be really scaled. But we'd love some feedback in terms of, where is this, has this worked? Are there some potholes that we should look out for? And then the last one is pilot projects. And this maybe, is part of the first round of certification modules we think about, where we hopefully will have some funding to support some pilot projects around the country that we can be very purposeful about in terms of testing the resources we produced, building a community of practice, and then supporting some evaluation processes to further advance our kind of knowledge about this. So that would be the ideal. I think it's promising, but I can't commit to that just yet. But we'd love some feedback on this overall framing as we kind of put some stakes in the ground and other content about those activities previously described. Any reservations about this that we should be aware of?
I think this is Jamie. No reservations. I'm super excited about all four of these things. I totally understand the wait and see about funding, but I think I'm most excited about the pilot projects and the idea of, I guess maybe a question and then my comment about pilot projects. Are all of the cases, and when you talk about pilot projects, is it all arts plus parks plus equals health, or are there some arts and health and some parks and health, or is it always all three of those things intertwined?
Are you referring to, you cut out just a little bit there, was that the case studies or for the pilot projects?
Both. I mean, the degree that you're asking for pilot projects to sort of exemplify and build off of these best practices.
We share time the rubric for the case studies, and we have a kind of we can. The presence of arts and culture, the presence of park or open space are part of that, but also the presence of a local health official in that process. If there's evidence about the impact of that. Part of it. There are obviously they'll be weighted differently. Some really lean on arts and culture, and that's more clear in the narrative. Others, conversely, arts and parks, but ultimately they should collectively paint, I think, a picture that puts all of those pieces in pretty fair relief. And then I think with the pilot projects, we want to continue to push that, and hopefully, based on this logic model, we can articulate what that will look like in a way that's effective and not, cumbersome or mushy or imprecise. So I think based on that, but we won't be exclusive if there's really if a pilot project is being led by or really driven by an arts and culture nonprofit in a community, that's fine, and we don't want to be so prescriptive as to limit that just because it doesn't have all three in perfect balance.
Yeah. So just to say again, I'm super excited. Thank you for explaining that. The pilot projects, just the need in the field to continue to actually have evaluations of this work, laying out the framework, laying out the on-ramps, laying out the case that these things should be measured is like where we are now in the field. And I think this is a huge contribution to that. And then following up with more specific evaluations, I think is really important. So, any ways that we can continue to support this needing to happen, count on us. And then also when you get to that point, the work that PolicyLink led through the CDI program here, specifically with Fairmount Park in Philadelphia, and then the two other health organizations. If anybody hasn't seen, I can't remember, the communitydevelopment.art website, health equity and parks, arts and parks are two topics within that research, and sort of the challenges of doing evaluation and of that kind of process evaluation and summative evaluation. They've really wrestled with it for the past 4.5 years. So I think they could be great partners, advisors, et cetera, as you get into that.
Okay, perfect. I want to, not to push this along too quickly, but I want to get to Kevin, who has some really great findings. If we have some time, we'll talk about case studies later on. I think that's the next. I'm going to skip that. I'm going to skip that for a second. I want to time so that Kevin talk about some of his research. Talk about how this will be incorporated. So Kevin's really been working over the past 3 to 4 months, building some work, and we've kind of been working in 2 tracks, and we've been checking in and connecting and kind of refining our work streams. And ultimately, this body of work is going to be incorporated into what you just saw. But we wanted to give Kevin the chance to introduce himself a little bit and talk about what he's been up to.
Thank you, Matthew. I'm Kevin Savasco. I was a fellow, IBM fellow at NACCHO, but I'm switching my career to public health. So I'm actually now switching to an internship at NACCHO. I'm currently working on my Master Public Health after several decades in IT. I'm more of a computer science MBA type, but caught the public health bug. So really excited. So working with Matthew and Geneva and the team, I was trying to look more at the health side to link it back to arts and park, and Matt described it well. From look at it as a triangle, with arts, parks, and health as the node. And if you can find all three, as someone asked earlier, in a project or a description, that's great. But a lot of times we were doing research trying to find links between two, and then sort of in aggregate building them together. And I think that kind of worked pretty well. And then overall, in putting a lit review document together, align the findings along with the existing TPL, how to do creative placemaking, because it is a broad topic, and trying to link those 3 nodes. So trying to put some structure to it to have a storyline that adds on to the work that TPL has done. So that's kind of the overall approach. He does work with public health, does lift the health of a neighborhood. And there's definitely evidence out there. Dr. Stern at Penn did a great project where he mapped, a stress index in Philadelphia on top of maps of, creative places, and he found, statistically significant findings for, especially in the child health area. And then you start looking at other work, like the work that Gallup does with their well-being index that shows, there's 5 areas that need to, that help you thrive. 3 of which map really well to that map really well to creative placemaking. Health in a community. Sorry, I'm switching. Social well-being, physical well-being, community well-being are 3 of the areas. So I think the importance of not looking. There's a tendency for coming from an MBA background, to view some of this with a skeptical lens. So, coming in and telling folks from that background, hey, yeah, improving the economy is great, but, even a group like Gallup will tell you, financial well-being is one aspect. There's lots of other aspects that need to be in place in order to have a strong, healthy community. So I think, this project was great from the perspective of pulling that together and having creative placemaking as a method to pull together all those pieces. So I'm really excited there. And Gallup worked with the Knight Foundation, and they found over and over and over again, surveying communities, that social offerings, openness, and aesthetics, that's across all 26 communities. That happens every year. I think that's a great foundation just to show how important creative placemaking is, in addition to parks, because it brings people together, as well as providing aesthetics. And, folks want to meet other people. So the openness that you get in those kinds of communities interactions, I think, are important. And then next is what Matt was saying about, health benefits of participating in the community engagement is important. Not just participating in the event or creative activity, but in defining it, being part of the neighborhood. There's definitely findings there, that showing that the neighborhood engagement in planning an activity, that network development is perhaps one of the most important aspects in health. So, and we heard that a lot on the last call as well. But in dealing with equity, we have to be careful going into some of these communities, and acknowledge kind of what state they're in. If it's an isolated community, with strong social capital, but maybe, you know, negative social capital, you know, going into, you know, a PTA in a suburb versus other neighborhoods, we have to be cautious and, you know, have the appropriate level of community engagement in dealing with these neighborhoods, you know, as they are, you know, dealing with the histories of them. And then lastly, Bridget brought in Dr. Our health equity expert from NACCHO. Oh, yeah, thank you, Dr. Hofrichter. And he talked to Matt, Geneva, and I and Bridget about an important thing we walked away with, you know, addressing inequity elimination versus mitigation. Because a lot of times it's just trying to make it better than it was, but, you know, keep an eye on these situations. Where can we try to really properly address and target to eliminate, you know, inequity issues? It's a big ask, but I think having a mindset of, well, what are you really trying to do when you go into the situation and you know, there's degrees of how you do it. So if you look over on the right, trying to contribute to the toolkit that they're building, two assets we think could be helpful to the team from NACCHO. One is the advancing the public health narrative around health equity, you know, how you learn to talk, and you guys were going in detail about the language. So there's a booklet that the NACCHO folks wrote that's really helpful in that aspect. NACCHO also does a lot of work in mobilizing partnerships. The local health department is frequently, you know, in the middle of a lot of efforts bringing different partners together. There's actually the MAP it's a massive toolkit of guides and processes and collaborations, recommendations, and things like that. So those could be very helpful. And then there's just a lot of other documents out there that others have done. Over in the UK, the Royal Society for Public Health and Philip Foundation wrote a massive document on arts, health, and well-being. And there's some, you know, stories in there, structures, recommendations that I think could be translated, some of which can be translated well from the UK. Obviously, they've got a different health, you know, structure with the NHS, but I think still there's a lot of valuable information in that. We've also talked a lot about community organizing. So when looking to find out to what degree has community organizing been applied to health, and there's a great study out of New Haven where rather than just doing a secondary data study for a community health assessment for the local nonprofit hospital, they went and created a community organizing, you know, hired locals, and they went into the, you know, underserved neighborhoods and tried to really, you know, find out what's going on and where the needs really are. So there's some excellent examples of, you know, finding community health needs apart from just looking at claims databases and other databases and coming up with a report that's just sort of regulatory compliant, but doesn't really show what's going on in the neighborhood. And then other zoning and planning, the healthy plan making, integrated health into comprehensive planning process. I think that was the association of the American Planning Associations or something like that. It's in the document. These all have good, you know, infographics, processes. Some of them have potential metrics. So I think going through these documents as you're building out the toolkit and creating the, you know, the rest of the toolkit has some very valuable information in there. Yeah, the role of local health boards and community design. So I've been focusing after our last meeting, Matt and Geneva, about really trying to, you know, find interesting things that I didn't see in the database that you guys built that could help on, especially the, you know, the imaging and framing and planning and collaborating side. So I think these documents that are all in the lit review could be quite helpful. All right, I'll pause for questions, or if you want to move on.
Yeah, thanks, Kevin. Any questions or reactions to Barb?
This is Sadia. Just curious if there's sort of there's the planning piece, but there's also sort of the policy of like health in all policies, and how much or little that has its own unique niche in this work.
Yeah, that's where I started getting into those planning guides, because some of them talk about like comprehensive community plans. So to what degree can, you know, creative placemaking insert itself in greater planning processes that are going on in a community? And the the second and third to last document go over those pretty well. And then the community health assessments, that's the tie to the Affordable Care Act, where the nonprofit hospitals every couple of years have to do a needs assessment. So yeah, when you're doing pilot projects, trying to tie yourself to existing planning, and those documents all seem to acknowledge the standard processes that might be in place in the community, and offer the reader some suggestions to go in and how to insert health infrastructure and plans into the overall planning process in a community.
And this is Bridget. I would say that when we're looking at, or when we were looking through some of the literature, I work on health and health policies at NACCHO, and it's not necessarily, I would say, been tied to arts and parks, or at least I haven't found too much explicit literature that's thinking about just arts and parks the way we were looking through kind of the literature forming this review, and we were thinking arts and parks, arts and health, parks and health, and then sort of all three of these dynamics together. I think that's a great point, and I think that could be something that comes out of the literature review as possibly a gap of where we haven't seen too much mention of this, or this could be something additional to add within some of that literature. So great point.
And the reason, just to give you a little bit of context about why I ask, is we're often sort of limited by the resources. And so if policymaking can actually sort of incorporate that into intentional work when it comes to community empowerment, for lack of a better term, right now, I'd be curious to see how that engagement, that neighborhood development piece, and in terms of planning, health and arts and equity really fit in there in terms of resource generation for the work.
Yeah, that's a great point.
And this is Jill. I'll just offer, I don't know if you've seen it yet. It's come out probably since you've done most of this work, but the World Health Organization issued its first report on arts and health earlier this month. And that's report's available on the WHO website. It's a really nice piece of work. There's a nice logic model in it that grounds the work that they did. It was a scoping review of the literature that kind of synthesized about 3,000 articles, and then I think they kind of integrated 600 or 900 into the review. So it's a really nice resource.
Great. Just cognizant of time, I want to make sure we have. I can go back one. We have a pretty good database of case studies, and we've been ranking them. And right now, I mentioned earlier that we kind of have a rubric for why we have, how they've been ranked that way. The question right now is to everyone is to keep thinking over the course of the next few weeks. One of the kind of asks going forward is to keep thinking about potential case studies that you might be aware of. And we're still in a kind of an inclusive phase. So if they don't quite meet all sides of that triangle as we're talking about, that's okay. We would rather have a really strong project with a good evidence base that meets a lot of the same principles that we can draw from. So no need to comment on this. I think the geographic diversity is one thing we'd like to look at in this map here and continue to advance that. But in terms of a kind of call for action coming forward, a couple things which are to any final comments about that logic model that we've presented to you, and then continue to think about case studies if you have time to do so. But I just want to thank Kevin, just thank you so much for your time on this project and your enthusiasm. It was really great to work with you, and I think both the work you did, but also I think it was just fun to hear your excitement about this, and it was just really great to have that. And so good luck with you and your continuing work with NACCHO and on your degree and after that. So please stay in touch. And thanks to everyone too. Have a happy, I think we'll probably do our next call in the new year. So some time off. We'll probably talk about kind of some decision making about the toolkit and where we are. But those two kind of to-dos will be great if you can think about any further comments in any case studies you can think about. So with that, I think we're at the top of the hour, and appreciate everyone's time today.
Thank you.
Thank you. Thanks,
Thanks,
Geneva.
everybody.
Thank you. Everyone.
Thank you.